Ladies and gentlemen, once again, it's my pleasure to welcome you to the Online Pregnancy School. As you know, we have been talking about family planning, and we made a distinction that planning a family and family planning methods are kind of not the same, though they are related. Because if you plan your family, you want to know how many children you want to have, how you take care of them. There are so many things that go into that. But then family planning methods are ways that can be used to, one, let you have the number of children that you want to have, and then the time that you want to have them. I have been discussing this topic with Dr. Benedict Afari, an obstetrician gynecologist, and he's shared a lot with us, including even some of the myths and misconceptions that we have heard about. And this is for everyone, irrespective of where you are in the world. When you hear this, you know that probably in your area, there is a myth or a misconception. If that has not yet been addressed, kindly share messages with us and we'll come back and address them. We want people to have the best health that they can ever have. And that's why we bring you the Online Pregnancy School. And please, even though the name is Online Pregnancy School, it's for men as well. It's not just women because they carry the pregnancies. No, it's for men as well, for the whole family. And even for those who are planning on getting married, this is a time that you can learn a lot. We have so many videos that we have posted. And if you subscribe to our YouTube channel or you join us on Facebook, you will be alerted anytime we have a new video coming up. So if you haven't done that yet, kindly go ahead and subscribe or like our page, give us thumbs up, share with friends and family, and together let us make reproductive health joyful. We don't have to have issues because we did not know. There's so much knowledge around that one doesn't have to stay without knowing what to do. Even the Bible tells us, for lack of knowledge, if we are not careful, we will perish. So please share with friends and family. Today, it's my pleasure to welcome once again Dr. Benedict Afari. We are going to talk about the injectables. I'm sure you know that there are many contraceptive methods out there. He has shared some with us. So we are going to discuss the injectables today. Doc, you are most welcome.
Thank you very much.
I'm happy you find time to join us out of your very busy schedule. You are very, very busy. There's always one woman or another pregnant who needs your help. But you also find time to join us to discuss so that those out there who haven't come to your clinic specifically will also benefit from the vast knowledge that you have. God bless you. So today we're going to talk about the injectables. What are the injectables, please?
Okay, so the injectable is a hormonal contraceptive method or drug. What it means that it is basically to prevent pregnancy. We have about two, the 3 month one and the 1 month. Just that these days we don't see the 1 month. Okay. The 3 months is called Depo. Most people know the name. The scientific name is too long. We don't want to mention it. So the Depo, a lot of people do it. And you can see something that I'm holding. It's just a small, this is a small bottle that is called a vial. So it's about 1 mils or one, the volume is just 1 mil. Yes. So it's very small, whitish substance in this bottle that I'm holding. So this is the Depo Provera, the injectable. What it means that for you to get a benefit of this, we have to give it to you as an injection. So the injection, we have places that we give it. Most of the time we can give it, there's a muscle around the shoulder area. We call it the deltoid. So we can give it there. It is intramuscular, so into the muscle. Or we can give it at the muscle at the buttock area, gluteal muscle. It can also be given there. So these are the places that we give the deep intramuscular medication. We don't give it through the veins, and we don't swallow it, and we don't put it anywhere else. It is an injection. So if you show up at any family planning unit and you ask for depot and somebody wants to give it to you, apart from it being given as an injection into the muscle around the shoulder area or around the buttocks, then that is not the right way to go around it. But God being so good, now we have another formulation. It's also depot. Synappress. That one is self-administered. The client can be taught to actually give to herself. I almost said himself. Yeah, so the client can be taught how to inject, but the Synappress is injected into the subcutaneous tissue, not into the muscle. The Synappress, it works the same way, but that one is given into the subcutaneous tissue, and a client can be taught to do it herself. Good. So that is how this depot, how it can be given. So now let's look at some other things. What does it do at all? All that it does is to prevent pregnancy. And it does that by preventing ovulation. Ovulation means what? The release of the egg. Once an egg is released and a sperm is around, you can get pregnant. So once there's no egg released, that means you cannot get pregnant. So what depot does is that it prevents you from releasing an egg. So once you don't release an egg, you won't get pregnant. And studies have been done. Let's see how effective this method is. So if you are going to get your injection every 3 months, you normally be given the date you have to come. So if you go strictly by the date that you are given and you are injecting it every 3 months, it's only one person out of 100 that can get pregnant. What it means that 99 out of 100 or 99%, you will not get pregnant. Actually, if you are using it where you won't get pregnant, but sometimes we realize that some people get pregnant not because they were not using the method well, but because they were probably pregnant before they went for the injection. So if you are already pregnant, the injection will not prevent your pregnancy. The injection only prevents release of eggs or ovulation. So it's a very effective method, and a lot of women have used it, and it has helped them.
Doc,
So that is how it is. So
before we continue, you said this prevents ovulation.
yes.
I want to know if the eggs are supposed to be released every month and we prevent them from being released, wouldn't that cause a problem for the woman?
No, it won't cause any problem. You see, the ovulation or the release of an egg is controlled by the hormones. So once you don't have the hormone, it will not be released.
Okay.
And the depot contains a small amount of progesterone. It is actually called a progestin-only contraceptive. Okay. So that means it has some progesterone it contains. And by virtue of the fact that we are giving you some small amount of the progesterone, the natural progesterone doesn't work. And that is why ovulation doesn't happen.
Okay.
So that's how it works.
Now, you also said that sometimes the person may be pregnant before going for this. If she's pregnant, she doesn't know, and she goes for the depot. Wouldn't that affect the pregnancy?
Fortunately, it doesn't affect the pregnancy.
Okay.
And you also know that early in the pregnancy, the baby actually needs progesterone to survive until the placenta comes in.
Sure.
And there are some women, we even give them progesterone to maintain their pregnancy. So it will not affect the pregnancy.
Okay. Thank you very much. Ladies and gentlemen, we are talking about the injectable, and this is a form of contraceptive method. If you have any question, if you have any comment, please share with us in the comment section, and doctor will be happy to answer them. If you have just joined us, this is the Online Pregnancy School. We invite you to subscribe and also turn on the notification bell. I'm talking to Dr. Benedict Afari, an obstetrician gynecologist. Doc, so we can continue talking about the injectable.
Good. So usually with these contraceptive methods, one of the things we have to talk about is the side effects or the adverse effects. And it's quite important to a lot of people. For DEPO, one of the commonest side effects is irregular bleeding. Irregular bleeding. And it's quite understandable because you are preventing ovulation. So usually, if you prevent ovulation, chances are that you will not get your menses. So then the menses or the menstrual changes that you may get may go between you not having the menses at all to you having irregular bleeding, or sometimes the bleeding can be heavy. So you can have heavy bleeding. Usually the first 3 months, you may have some irregular bleeding, some heavy bleeding, or your menses doesn't even show up in the first place. But your menses not coming is perfectly normal. It doesn't affect you in any way. It will not give you cancer. It will not give you fibroid. And it will not prevent you from getting pregnant later in life.
Hey, Doc. A woman not pregnant, not seeing her period, she will be worried.
Yes, definitely, yes. But that's why we are giving the assurance that even though your menses may not show up, it is completely normal and it's not going to harm you in any way. So they should be rest assured that it will not harm them. Yes.
We hear you. Okay.
And one of the other side effects is that there is some weight gain. Weight gain. So some people may gain some weight, maybe some 1 kilo to about 2 kilos. I mean, from time to time. But I've actually seen some women that they've used Depo for years, but they are not obese or they've not put on weight. So usually it is case by case basis. Some people may have the natural tendency to put on weight. So they may put on some weight. But interestingly, there are some women who really want to get some muscle bulk and to put on some flesh. So this is a non-contraceptive benefit to such women. So you put on some flesh and you'll be fine. Yeah.
Okay.
Then the other things that you may get is that sometimes, especially in the first 3 months, there may be some dizziness, feel some lightheaded or some nausea and vomiting. Usually, once your body is getting accustomed to the hormone, you may feel some of these symptoms. But within 3 months, you are perfectly back to normal. And let me add that some people report that they have high blood pressure.
Okay.
When you normally go to the family planning unit, we need to do the counseling, take your vitals, look at your risk profile to be able to determine whether you are suitable for this method or not. So it also doesn't mean that because of BP or fear of your blood pressure going up, you will not use the method. What we say is that if your blood pressure is more than 160, 100 and above, we are not going to give you the method. Okay. But if it is less than that, you can be given the method. There's no problem. So it is those who report high blood pressures who will not put them on the method. But if your blood pressure is normal or it is well controlled, you can take the injectable. Yes.
Okay. So, Doc, it means that for those who are even hypertensive, they know that they have high blood pressure, they can still be on the depot.
Yes, once it is well controlled.
Okay.
If it is not well controlled, you won't put you on it. Once it's well controlled, you can take on the injectable. Yes.
Okay. Okay, Doc. Are there any other complications that we should be aware of? And you told us about the chances of becoming pregnant, 1 in 100. So 99% of the
Yes.
time, the people will not become pregnant if they stick to the schedule. Has there
Yes.
ever been an instance that you know of where somebody has had a very bad complication that had become life-threatening?
Yes. So especially if we don't go through the medical eligibility criteria, well, you can get a very bad complication. For example, if you have the tendency to form clots,
Okay.
you can develop clots. So such people, we don't put them on. And maybe you've had a stroke in the past, or you have very high BP. You know, those who have very high BP, they can develop stroke.
Yes.
So, for example, such people, if we didn't know and we put them on it, they can have those bad complications. Then the other thing is that if you have a liver problem, especially liver cancer, we wouldn't
Okay.
put you on the method. Then I talked about if you also have a heart condition. If you have a heart condition that have already been diagnosed, you will not be put on it. So heart conditions, some liver conditions, stroke, and
Okay.
those who have very bad BP, those people will not. And if you have cancer too, breast cancer, people, for example, we don't put them on it. So
Okay.
some people who have cancers, stroke, very severe hypertension, liver cancer, and the rest, those people, we don't put them on the, because if you put them on it, they can get very bad complications. So we don't put them on the method.
That is very important to know. Ladies and gentlemen, we have always said that when you go to the hospital and you are asked any question about your history, past and present, please tell them the truth. If you have ever been on treatment, if you have ever been diagnosed with any disease in the past, don't hide it. Just let the health professionals know. It will be for your own good and for your benefit, so that it will help them to give you the appropriate treatment that you need. Doc, thank you very much. Is there anything else as we round up on the injectable? Is it how can people get abscesses? For example, can somebody get an infection at the site and every 3 months going for an injection? Do people comply? Do they come or they don't come?
Yes, so yes, you can get an injection abscess or very severe pain at the site if you don't receive it from a qualified and well-trained personnel.
Okay.
So those are local problems you can get. Some people maybe have some allergic reaction around the site. So swelling, redness, or even inflammation, infection, it could happen.
Okay.
But we stick to the aseptic procedure. Make sure that we are giving it at the right place, using the right needle. And the right person who has been trained is the one
Sure.
doing it. Yes, once we're able to comply with these, chances are that you will not experience some of these things. And the women, they come. I mean, those that we have actually canceled them, they know the benefit. They come every 3 months, they will come. When they come, we'll give them like a card, and the date is written.
Okay.
Then we also advise them that they should try and stick to the date, because if you don't stick to the date, chances are that you will get pregnant.
Sure.
And you blame the method for making you pregnant.
Yeah.
Then the last thing that I want to say that for depot, sometimes return to fertility can be delayed for about some months. So some people, it can delay for about up to about 9 months. But
That's when
usually
they
within
stop
a
using
year,
it. When you say
yes,
return to
when they stop
fertility.
using it.
Okay.
Yes. So when you stop using it and you want to get pregnant, sometimes it can delay for some months. But within a year, definitely get pregnant. So I think I need to put that one across.
Sure.
That sometimes it can delay a bit, but But if not, everybody can get a depot. I mean, if you are young, you are old, of course. If you are a menopausal woman, you don't take it. But any woman within the reproductive age group, even breastfeeding mothers,
Okay.
after yes, even breastfeeding mothers can, because it doesn't contain estrogen. You know, usually within the postpartum period, the risk for forming clots is high. So we try and not give the estrogen containing pills. So, but progesterone can be given, even those who are breastfeeding, adolescents, women in the reproductive age group, all those people can be given. So it is good for a lot of people. Those who don't have to take it are the ones I have mentioned already. Yeah.
Thank you very much, Doc. You know, this last session that you just spoke about is very important. Ladies and gentlemen, there are people who go on maternity leave and resume with another pregnancy. It will not be good for your health as a woman to have pregnancies within very short intervals, and also for the care of the baby.
Yeah.
It can be challenging.
Yeah.
So Doc has told us that even if you are breastfeeding, you can have this injectable. You take your child for the child welfare clinic. So it's an opportunity for you to also see the family planning unit people and then discuss with them wherever you are in this world listening to us. When you go to the hospital, you are breastfeeding and you want to just put some interval between your next pregnancy, which is good to do, then please visit the clinic and see what is available for you. But it's good. He has told us you can use it whether you are breastfeeding or you are not breastfeeding. That is very important. We want to thank you so much, Doc, for your time. Ladies and gentlemen, I hope you have learned something very, very, very important today about the injectable, when it can be given, when it cannot be given, some of the complications, and what we should look out for. But remember that when you go to the clinic, they will surely take you through a system and see whether this is good for you before it is given. Until we come your way again with another topic on family planning, stay blessed. Thank you.